Hello everyone, I am Dorothea Orem and I'm here to talk about my theory. So first, let me tell you about my credentials. I was born in Baltimore, Maryland in year 1914. I obtained my nursing diploma in Providence Hospital School in Nursing in Washington, D.C. My bachelor's degree in nursing was obtained in Catholic University of America. And I obtained my master's degree in the same school. My theory focuses about the tendency of the person to maintain his or her health and well-being, because I believe that each one of us has the ability to take care of themselves. My theory has three conceptual theories, which is the self-care deficit, and nursing systems. The theory of self-care. This theory talks about the ability of the person to perform self-care to his or her own self. It has three components, namely the universal self-care, which talks about the life processes, for example, maintenance of basic needs of human. Developmental self-care, which is developmental processes, for example, learning, healthy eating, and toilet training. Healthy patient self-care, which talks about the self-care required in conditions of illness, injury, and diseases. The theory of self-care deficit is about the person has the ability to meet self-care needs, but if a person has an inability to meet his or her needs, thus self-care deficit exists. The theory of nursing systems talks about the ability of the nurse to aid the person in meeting current and potential self-care demands. Nursing system has three support modalities, and these are the wholly compensatory, partially compensatory, and the educative supportive.
In wholly compensatory is where the nurse will do all the care, and an example of this is a person in coma. Below is an example situation. There you will see the nurse doing all the actions that was supposedly to be done by the patient. But because of his inability to do so, the nurse is the one doing it to maintain well-being. In partially compensatory involves both the nurse and the patient sharing in self-care requirements, and an example of this illustrated below. Here you will see the nurse assisting the patient in the wheelchair.
Ma'am, pwede kain ka o tama? Okay, nagsulod-sulod ka sa katahagawas, tapos naiihin ako, tapos di ako makasulod na doon. Hindi ka man nila, ma'am. Oh, di lang ako room. Aliman nga room. Sige. Okay lang, ma'am. Thank you.
In educative supportive, the patient or client is responsible for the health care, and the nurse is only there as consultant, teacher, or resource. An example of this is shown below. A pregnant woman is asking for what to do's and what to don'ts. During pregnancy, the nurse is giving her advices and explain things for the better understanding of the patient to the situation.
Ilang taon ka na? 18 po. 18? So, sino kasama mo sa bahay niyo? May nag-aalaga ba sa'yo?
Meron po, nanay ko.
Kailangan sa OR ASAP.
Nurse, ikaw na bahala sa i-assess mo yung ano niya, ha? Ito yung vitamins, ipatake mo sa kanya. Mauna ako, ha? Ingat.
Bye po, Dok.
Sige, ma'am. So, ito yung vitamins a day. Once a day lang ni ma'am, ha?
Opo.
Oh, sige. Saan ka mabalik, ma'am?
Next week din po,
Sige,
ma'am.
sige. Next week? Sige. Sige, ma'am. Ang mula to.
Thank you,
Sige.
Dok.
The nurse's roles depends on what compensatory is needed by the patient,
Anak niyo.
and in that way, achieving the optimal health and well-being of the patient is achieved.
Ay, ang ganda niya.
Pagmanahan.
Congratulations, Mommy.
Thank you, Dog. Thank you, nurse.
Ha ha ha!